In terms of the HIV epidemic, we definitely see that it disproportionately impacts people of color. And within the iTech, we take that to heart in the interventions we design to ensure that we're meeting those populations where they are and that we're addressing the HIV epidemic, for them. Part of what we do is ensure that the community, again, has a voice in what we're doing. And that ensuring that we're designing interventions that are sort of culturally relevant and really address the issues that the populations who are most impacted are concerned about. Certainly, HIV is definitely a huge issue in the South. And it's part of the reason I came here to train many years ago was particularly to address the HIV epidemic in the South. We have study sites actually all over the country, however, but we do have a predominance of study sites in the South. So we have sites in Texas and in Florida and in Georgia that will be doing our studies to ensure that we, again, are addressing this epidemic where it's hitting the most. Within the iTech, again, we are having 6 individual studies, but they all build off of each other. And in creating this grant and writing this grant, my co-investigators and I really tried to include interventions that would address every aspect of the HIV care continuum. So we have interventions that address HIV testing and try and increase testing for youth. We have interventions that really focus around pre-exposure prophylaxis, or PrEP, which is a medication to prevent HIV, and interventions that focus on increasing access to PrEP, uptake of PrEP, and adherence to, so taking it daily. And then we have interventions that target youth that are positive and really aim to engage youth in care and help them to take their HIV medicines daily to the point of viral suppression, which is really, for us that treat HIV, is sort of the best that we can hope for to really hope to end the epidemic. Yeah, some of that will be determined. Communication and collaboration is certainly key, will be key to the success of the iTech. We have a great group of collaborators that have been doing this type of work for many years and are used to working, in multidisciplinary settings and used to collaborating. We also work very closely with the communities that we serve and making sure that they have an input and a role in the studies as they're being implemented. And so, a lot of conference calls, a lot of video calls, a lot of, in-person meetings, and just ensuring that we have open communication throughout the whole process. In addition, we are hoping that the network that we're creating will foster new ideas and innovative science that can add on to the studies already planned. Yeah, in terms of, metrics for success, I think that there's a lot of different ways and means that we evaluate it. I think for research in the, NIH, sponsored research, we really have to show some biologic outcomes. So our success is measured in terms of, for instance, our study for positive youth. Success is measured as to whether the technology actually leads to greater adherence and greater viral suppression. So I think, the end game is sort of the biologic success. The other pieces, though, are really important. How acceptable is the technology? Did folks use the technology? How long did they use it? And so you start to, what are the components of it that were the most effective? So I think there's a lot of ways to measure success, but at the end of the day, we need to address the epidemic. And the way we address the epidemic is by preventing new infections and treating those that have it.